I would like to welcome tonight, I'm very proud to welcome our a student that we know well from Belmont University, doing her capstone program in with NAMI Davidson in occupational therapy. And she's got a lot of experience through her studies. And her name is Natalie Metzger, and we are delighted to have Natalie sharing this topic with you tonight. So I'm going to let you discuss what your background and experience is as you give your talk, but we're very much looking forward to this, and I'm handing it over to you, Natalie Metzger. Thank you very much.
Okay, thank you so much for the intro, Robin. I just wanted to thank all of you guys for taking time out of your night to learn a little bit more about occupational therapy. Tonight, my big main topic is going to be occupational therapy's role in the mental health community. So just to start off, a little bit of background about myself. I attained my bachelor's degree in dietetics from the University of Kentucky. I've always been really passionate about holistic health and really love learning through this degree how much nutrition could play a role in improving the quality of life for people. I'm currently in my last semester of occupational therapy school at Belmont to attain my doctoral degree. The program is 3 years overall, and I've really learned so much over these years and have really grown to love the profession even more than I had initially expected, because the work we do is really meaningful and I get to help be a part of patients' recovery journey. So this picture to the right was taken at Belmont during my classes and I pinning ceremony. The formal pin represented the completion of my didactic work, which is basically the schoolwork, before we all went to our 2 12-week clinical rotations under practicing occupational therapists. My first level 2 fieldwork was completed in Louisville, Kentucky at a place called Lee Specialty Clinic. The client population there consisted primarily of adults with intellectual developmental disabilities. However, I did have some exposure to patients with varying mental health diagnoses, including anxiety, bipolar, and major depression disorder, which I'll get to my experience a little bit later in the presentation. And my second rotation was completed in Memphis, Tennessee, so not too far away, about 3 hours, at Regional 1 Health, where I treated patients with varying physical impairments. And this mainly looked like patients with spinal cord injuries, traumatic brain injuries, gunshot wounds, motor vehicle accidents, and amputations. So big picture, what is occupational therapy? Occupational therapy is a client-centered health profession concerned with promoting health and well-being through occupation. So you may be asking yourself, what exactly is an occupation? Does it just mean a job? Well, no, occupations refer to the everyday activities that people do as individuals, in families, and with communities to occupy time and bring meaning and purpose to life. Occupations include things people need to do, what they want to do, and are expected to do. So the primary goal of occupational therapy is to empower people to participate in their activities of everyday life and become as independent as possible. We enable this engagement through adaptations and modifications to the environment or objects within the environment when needed. So when exactly should someone seek out occupational therapy services? So if there is a disruption in any occupations, or once again, those meaningful everyday activities. So these next 2 slides are going to be the main occupations according to occupational therapy. So starting with activities of daily living, these are also known as ADLs. And these are activities oriented towards taking care of one's own body and these fall under the need to do category. They are vital for basic survival. So these include things such as bathing, showering, dressing, toileting, personal hygiene, sexual activity, functional mobility, which is moving from one place to another, eating and swallowing, and personal device care. The next main occupation that we look at is instrumental activities of daily living. And those activities are going to support daily life within the home and community, but they're going to be a little more complex, a little more higher level compared to activities of daily living. So some examples of these include caring for others if you're a caregiver, also caring for pets, financial management, driving, health management and maintenance, home establishment and maintenance, meal prep, safety and emergency maintenance, and shopping. So the next one is going to be education. So these activities are needed for learning and participating in the educational environment. So this can include people participating in academics, so subjects such as reading and math. Non-academic, are they able to function and participate in the lunchroom or at recess with their friends? Also extracurricular activities. So whether people are involved with sports or band or dances, anything like that. Next is going to be work, and these are activities performed with or without financial award, such as looking at employment interests, employment seeking, job performance, retirement preparation, and volunteer work. Another one is going to be social participation, and these activities involve social situations with others. So this is going to look like the ability to interact with the community or with your family or with your friends. Leisure activities are going to be non-obligatory activities that are intrinsically motivated to the individual, and they're engaged during downtime. So an occupational therapist may assist someone with identifying their leisure interests and then looking into finding opportunities in this interest and figuring out how to participate in them. So the last main occupation is going to be rest and sleep. And these are kind of self-explanatory, but these are activities related to obtaining adequate rest and sleep. And examples of what this would look like would be an OT assisting someone with sleep preparation and sleep participation. So how do occupational therapists work? Well, when you see an occupational therapist, it's always going to start out with that assessment piece where the OT and the client really work together to focus on the individual and their environmental abilities and problems related to the person's daily life. So this can include standardized procedures, interviews, observations in a variety of settings, and also looking into consulting with not only the individual, but significant people in the person's life. The next step is going to be planning, where the OT will examine the results of their initial assessment and develop a client-centered plan to meet the client's short and long-term goals of treatment. And it's important to note that this plan is always patient specific and really looks at their developmental stage, their habits, their roles, their lifestyle preferences, and their overall environment in which they live. So the last step of the process is the intervention stage or the treatment phase. This phase is designed to facilitate the performance of everyday tasks and adaptation of settings in which the person works, lives, and socializes. So some examples for the intervention phase may be teaching new techniques and providing equipment, which are going to be able to facilitate that independence in personal care, or reducing environmental barriers and providing resources to lessen stress. So where do occupational therapists work? We work with all age groups and in a wide range of physical and psychosocial areas. So this can include hospitals, schools, nursing homes, rehabilitation centers, home health, physicians' offices, private practices, acute and long-term psychiatric facilities, military institutions, and employment programs. So the history of OT dates all the way back to the 1900s through 1920 during World War I, where there were large numbers of wounded men requiring assistance to resume their daily living roles. The focus of OT was a really holistic point of view, and OTs looked beyond just medicine to find a sense of mental achievement and being productive. The influence from the arts and craft movement was used therapeutically to increase leisure and productivity through the connection of the hand and mind, resulting in overall health. So the next movement during the 1930s, OT programs were set up to assist newly discharged patients to develop tolerance to work. And this included vocational training and industrial therapy programs. Vocational training included instructional courses that focus on the skills required for a particular job. And the industrial therapy programs were designed with the goal of facilitating an individual's safe and timely return to the work environment following their injury or illness. So next, around the 1940s and the 1960s, rehabilitation was needed even more for large numbers of disabled veterans. So OT started to address orthopedic, neurological, and psychiatric conditions for the returning soldiers. One of the main psychiatric conditions focused on during this time was PTSD, where occupational therapists train these veterans in activity of daily living skills. And after World War II, legislation allowed occupational therapists to serve in the military and be on that front line due to the positive outcomes that were seen from their work and working with the veterans. During 1967 through the 90s, it brought about the idea of occupational therapists working on self-regulation with clients. So self-regulation is defined as managing thoughts and feelings to enable goal-directed actions. And then the 2000s to now has been a very client-centered era to empower individuals to meet their goals. It also has been huge in technology, and there's been the invention of speech recognition software and wheelchairs, and adaptive equipment has been discovered and utilized. So the support of health, well-being, and quality of life emerge as part of our roots. So there's new opportunities for us emerging in roles with advocacy, leadership, and building and applying evidence to support our services. So getting a little more specific into the mental health field, what knowledge and skills do occupational therapists teach in this field? So these are going to include things such as communication skills, problem-solving skills, ADLs, which are those activities of daily living I was talking about a little earlier. And these are, once again, the activities oriented towards taking care of one's own body, like showering, bathing, toileting, things of that nature. And then also instrumental activities of daily living, which are going to be a little more higher level than activities of daily living, and they're completed within the home and the community. We also teach time. We look at vocational interests. We look at self-awareness, stress management, role development, and overall wellness. An important area of mental health occupational therapy that can be addressed in certain states is psychotherapy, which is also known as talk therapy. And this is going to include a variety of treatments that aim to help a person identify and change troubling emotions, thoughts, and behaviors. So elements to this can include applying mindfulness and relaxation techniques, tracking emotions and behaviors to increase awareness of their impact of each other, or even creating a safety plan for a person who has thoughts of self-harm or suicidal ideas and helping them recognize those warning signs. When is psychotherapy used? It is used when clients can't participate in their daily occupations due to their declining mental health. And this can look like struggling with a severe or long-term stress from a job or family situation, the loss of a loved one, or relationship family problems. Having symptoms with no physical explanation, such as changes in sleep or appetite, or having low energy level, or a lack of interest or pleasure in activities you once enjoyed, excessive worry, or a sense of discouragement or hopelessness that won't go away. It can also be used to support a family member or child who has been diagnosed with a condition affecting their mental health. Now, going back to my previous clinical experience at Lee Specialty Clinic, I treated numerous adults with intellectual developmental disabilities and a variety of mental health diagnoses. Most commonly generalized anxiety disorder, major depression disorder, bipolar, and schizophrenia. So some of my, the most common areas of treatments looked like working with this population on safety and emergency maintenance, sensory integration, financial management, employment interests and pursuits, personal hygiene, social participation, and emotional regulation. So this is an example. I worked with a patient with depression who relayed to me the struggle of establishing a personal hygiene routine. He described it as being really challenging to organize each step of the process and overwhelming. So I worked with him to create these educational materials to simplify these personal hygiene tasks for him. And at the clinic, we practiced these steps together to ensure he understood and just the correctness of it. And he was able to take home these educational materials and use them. So another example of my experience at Lee Specialty Clinic included the zones of regulation, which is an occupational therapy intervention focused around emotional regulation. This helps clients in their ability to recognize, categorize, and communicate their feelings. When a patient is able to connect how their body is feeling and identify that emotion, this is what occupational therapists refer to as interoceptive awareness. And as you can see on this chart, it categorizes their feelings based on 4 zones with techniques aimed at regulating themselves back to the desired green zone, which indicates feelings of happiness, calmness, and focus. And even though this example was used for the IDD population, this tool is really beneficial for everyone looking at your emotions and how you can regulate yourself back to feeling happy and focused and good to go. So mental health services in Tennessee. So occupational therapists can be part of mental health treatment teams in psych wards, hospitals, and outpatient services. So OTs can fall into the qualified mental health practitioner title, but only some states get this title. And someday we are really hoping to be licensed. So we're going to continue to advocate for our profession and get on that qualified mental health practitioner title. But as of today, only Illinois, Maine, Massachusetts, Missouri, Montana, Oregon, and Virginia are the ones that are going to have occupational therapists be under the qualified mental health practitioner. So lastly, my involvement with NAMI Davidson. I will be completing my capstone project. So I'll be creating a life skills guide for supported recovery for NAMI Davidson. Some educational topics I may be including are motivational tactics, building resilience, maintaining well-being, structuring daily living, taking care of oneself, and supports available through the recovery process. So since I'm only in my second week of my 14-week capstone project, there is going to be further research done regarding the topics. And if you guys have any input, I'd love to hear any suggested topics that will be beneficial for you. And then, Robin, did you want to talk about the rock garden?
Yeah, sure. And I see Don is yes to Don in the chat. That was a personal chat item. Thank you very much, Natalie. I think you've hit on a lot of things here. One of the things that we are focused on at NAMI Davidson is we are tired of seeing people receiving treatment in an illness model. And what that means is very often what we hear is, so you just had a hospitalization or maybe a crisis or maybe a bit of a dip. So you feeling better now? Call us when you get sick again. We would much rather see people contact us through their recovery and, and be supportive in that recovery for them. The rock garden is something, and we've got Ann O'Halloran here tonight from Vanderbilt. We are very proud to be Vanderbilt Behavioral Health's first social work fellowship program project. And so Ann is one of the leads on that project. And we have two young social work fellows who have been working with us, plus one of our own people in addition to Natalie. We have Tony Kelly. And we've developed something called, or we're working on something. And Ann, as you pop up, I'm gonna give an explanation, and then I want you to feel free to jump in here. So we've come up with something that we really see a benefit in working on recovery, but we also know that recovery is a rocky road. And in mental health recovery, there aren't a lot of how-tos and there aren't a lot of roadmaps. Very often, if you were somebody that was recovering from a substance abuse issue, you would be told, okay, you've had a crisis. Now let's get you into a therapeutic environment. Now that you've been through an intensive therapy, we're going to do a step down with you into a very structured, maybe halfway house. And then after and we're going to involve your family too, if one is around. We're going to really, encourage that. Then what we're going to do is have you step down further into maybe what would be an honor house. And you'll have support of your peers and other people. And we're going to see that you're, maybe going for a job or going back to school. And then from there, we're going to step down and maybe you're going to have a sponsor that's going to help you maintain your recovery. We don't see that in primary mental health recovery. We see people who have a crisis and go home to their bedrooms and don't come out because there is no one there to say, hey, come on over here. And what Natalie's part of this project is to be that, hey, come on over here person and to help set that up. The rock garden is the second step in that. Where are you going to go after the bedroom? First, you're going to go to the living room. And we don't take that step lightly. We know that can be a very, very big step. And we want you to understand the things that Natalie was showing you, the step by step in care. When your brain has been through a crisis, when that organ in your body has been through a crisis, you may need to take it step by step. And there's no shame in that. You do it for any other organ in your body. You do it for your heart. You do it for your liver. You do it for your pancreas with diabetes. You give yourself permission to take steps and not expect to be sprinting after a major crisis. So the rock garden was developed, and I loved actually Ellie and is it Abby?
Ellie and Abigail. Yep.
Yep. So Ellie and Abby are the two social work fellows, and they had actually, we were trying to look at, how would we describe, what it is we're trying to do, and they had come up with a terrarium. And the only problem with the terrarium is it's kind of closed, and we wanted it to open, but the concept was still there. So what we want you to think about with a rock garden is that beautiful things can grow in hard places. And they find a way. They weave through the rocks. They find their own path through the rocks, but very often they get there because they're being tended to by somebody. And so this is something that we're doing. And Anne, excuse me, would you share how would you share about the focus groups and what we're trying to do, and put a call out for the focus groups? Would you mind doing that?
Sure. Robin, I will do my best. I'm going to say what I know and you hop in to correct me.
I will do that. But I wanted to give you time to talk about the program just a little bit, because you guys it's been wonderful to have this relationship.
I agree. We're really excited. As Robin mentioned, this is our first launch at a social work postgraduate fellowship training program. And it was really important to us for a well-rounded experience for the fellows to have a community segment to their fellowship and their training. And Robin was there for us to step in and provide us with the opportunity, which turned out, I think, if I may say so, better than we ever could have anticipated in the beginning. So with the rock garden, part of the work being done right now is to get some focus groups, to get some feedback from key stakeholders, including family members and persons with experience, to help develop and really ensure that the programming that we put in place and the services we put in place are meaningful from every perspective. Again, as Robin had mentioned, we're really looking to help make a map, and not everyone's map is going to look the same. So we need as much perspective and as much vision as we can so that we can really build a versatile map that will be helpful for most, if not everyone.
Thank you. And I think that's a really good description. And the goal of this is, one of the things that we really took this concept of support from were the Clubhouse International models. And they are a model of empowerment, and support in recovery. What we hope will happen is that people will, Natalie is developing a guide for us for family members and people with lived experience. That is the first step that will take people to this second step, which is the rock garden, and and learning to get on their feet more. And then we hope that people will then be able, if they choose to, this is all, empowering a person to be who they want in their own recovery. But if they choose to go on to a supported employment program with a job coach, or maybe go back to school, but all this is focusing on recovery and resiliency. And that's what we are hoping to do. Not so much call us when you're not feeling well. This is, hey, come on over here and let's see what we can do to support you. So so we're really pleased. Now, Natalie gave you a lot of information. Does anybody have any questions for Natalie?
Daniel, do you have a question?
Yep.
I do. I had a question about the adaptive equipment. I'm not familiar with that. Could you explain what an example of adaptive equipment that an occupational therapist might utilize in working alongside a client?
Yes. Okay. So based off of my second rotation that I had in Memphis, some adaptive equipment include starting with a sock aid. So a sock aid, it's kind of hard to describe without a picture, but basically it's a device where you can put the sock at the bottom of, it's kind of like a tube, and then you slide the sock over, and it has strings on the side so that people that have any physical impairments with their hip and are not able to bend forward, they can just throw the sock aid down and pull them up with their arms so that they're not further injuring their hip. Also, adaptive equipment can even mean like adaptive silverware. So if someone has, you know, an injured hand or wrist, we have like curved utensils, like it's called like a U-cuff that they attach here. And so they're able to participate in eating versus having to involve like more digits. Also there we had leg lifters, which the patient's in a hospital bed and they're not able to bend their knee at all. It's a device where it's basically just like a long like rope type material, and then it has a little insertion at the end where you can put your foot in and you can move your whole leg as a unit versus having to, you know, damage that knee even more if you can't bend it at all. Trying to think, adaptive equipment can also mean like walkers or wheelchairs, anything of that nature. It can also be just as simple as that, like that's the text feature. If someone, you know, if their hands are injured and, you know, they're needing to still participate in work, the invention of the speech to text can really be a useful device in being able to allow patients to continue in their work.
And I'm going to ask, thank you, Dad. Like, I'm going to ask Don to bring down the presentation so we can see each other a little better. And
It's me, I'm sharing the screen.
Oh, you're sharing the screen. Well, let's go ahead and take it, and that way we can see each other. I would like to add to that adaptive equipment, in especially in the mental health field. We have seen sometimes where patients are supposed to be taking meds at, you know, particular time, particular dosage, and we've had Dr. Joseph Pan did have, and we've seen this from other pharmacists, that one of the biggest problems is not people not taking their medication, it's not taking it as prescribed, and therefore it's not as effective. And so there are machines, or you can go to your pharmacist and ask that your medication be put in dosages for you, and so that you're not having to remember to get this out every day. That and there are actually some places you can have a dispenser at home that'll dispense, and the timing is built into the dispenser, and that is something that can be helpful to people. And adaptation, and Natalie, make sure I'm thinking of something, but it may not be occupational therapy, so you call me out if I'm wrong, please. We know that some adaptive things that can happen in when you're in college, and you've got maybe you've got an anxiety disorder, especially testing anxiety or something like that. You can then go to the school and say, I need some help with this. Can I take an individual proctor test, or can I have more time for this test? I have a condition that somebody else might need crutches. I need this, and so something that Christine Manville taught me that got me interested in occupational therapy at the very beginning, that just and really spoke to me personally, because anybody that knows me knows I'm high energy, and I don't like sitting in one place at one time for very long. That can be difficult. And so Christine was teaching me an adaptation, which is learning the pressure points in your body, and wrapping your ankle around a chair and pressing it to release some energy, or pushing your arms against your side, or what are you doing there, Natalie? Okay.
One as well. This is also a pressure point.
Share what you're doing and when you would use that. When would you do that?
So basically, when I definitely struggle with test anxiety, so I have used this and know it works. But there's different pressure points throughout your body that automatically release stress. And for me, whenever I had a big exam, one of the pressure points is going to be here, which it is towards the bottom of your wrist. It's this pad right here.
Okay.
So holding that down for 3 seconds. I do 3 seconds and do 3 times.
Okay.
But that's the one that works for me.
And this is what I found about occupational therapy that got me so interested in it, is it's very practical. It is so practical, and you don't need equipment to do what you just did, and still be able to lessen your anxiety, and do what you set out to do, which is to take this test if that's what's needed. That's what I love about this particular field, is it's so practical. And so there are other things, and it's practical and it's personal, because an occupational therapist will work with you to find out your personal path to these little I'll call them tricks. They're not, but so it really that to me is, what did that cost, and but what's the impact of it? It can really have quite an impact. So we want to it's not, as you had mentioned during your presentation, this is not a clinically licensed practice in Tennessee. It's not because it's a bad practice, it's because it just hasn't been brought up to be licensed yet. There's a lot of hoops to go through to get that to happen. But I for one would certainly love to see that happen. When someone is licensed, that means that they can then they can usually be included for insurance and billing and things like that, which would get broader use of that particular profession. Has anybody, I'm going to throw this out since we've got time and this is a smaller group tonight, are there things that any of you have used that that Natalie was just showing us? You may be doing some things that you don't even realize fall into this category. Does anybody have a go-to when they get stressed? I've heard of rubber bands on wrists. I've heard of that. I've heard of, and somebody might help me with this, there is a distracting exercise you can do so for self-distraction. And you'll see 5 things, then and then 4 things in the room, and then 3 things in the room, then 2, 3, and then 1 thing. Usually by the time you are done doing that, you have distracted your brain. Very often you have slowed down your breathing, and then you can be present, you know, in the environment that you are in. You know, so much of this is making friends with our brains. and that's a really good friend to have. So because when you know, when we're in opposition, that can be really, really hard. But you know, these are ways for you to move within yourself. I see some nice strong head bobbing. Anybody else have any other comments or contributions they would like to make? Well, if I'm gonna thank Natalie for an enlightening presentation, and really appreciate that. And thank you for your contributions. And Daniel, thank you for your question, because I think that was really helpful. I think when I really want you to leave with one thing tonight. When you hear occupational therapy, I don't want you to think employment. I want you to think what occupies you. You know, in your day, what occupies you, and how can occupational therapy help you to do that more successfully? That's what I would love you to think about when you think of occupational therapy, is what occupies you. So I want to thank Natalie very much for that. I'm going to toss it over to Don Liacono. Don, we have some things that we do around NAMI Davidson that people find helpful in recovery. You want to share some of those with us, please?
Well, we have support groups for one. This week we have tomorrow night is our Thursday nights are for lived experience individuals, meaning people who have a mental health condition. Tomorrow night is our full Bridges support group from 6:30 to 8. It is virtual. Everyone is welcome. We still have space allowed. This weekend on Sunday, we are our caregivers only, our WIM, our With Hope in Mind caregivers only support group meets in person at Christ Church, Nashville. You can register through our website or through the emails that everyone who's registered tonight gets. I send out an email on Mondays and Wednesdays, and the links to our groups are usually in the Monday one. So those are the support groups coming up, but we also have some classes coming up. The last weekend of January, the 28th and 29th, we are hosting a WRAP, a Wellness Recovery Action Plan class in our offices at Harding Place. Amy Lawrence of Robertson County, NAMI in Robertson County, will be facilitating that. That is for people with lived experience to develop a plan, a recovery plan. Caregivers are welcome, but know that it is designed for people with lived experience. We also have our family to family class, our spring family to family class coming up in person in March. It is being hosted by TriStar Skyline Madison. It is a 8-session class for caregivers, loved ones, family, friends of people with lived experience to learn more about mental health issues, communication skills, self-care, you name it. It is 8 sessions over 4 consecutive Saturdays. We'll have a morning and an afternoon session with lunch in between. We still have space for that. You can register through the links I've sent, or just email me directly at outreach@namidavidson.org if you have any questions, or I'll help you through the registration process.
Thank you, Don. And
I will also add, because this is an educational session, we have 2 education sessions confirmed. They're not on the website yet because I'm awaiting some information for the flyers, but in February, on February 15th, we are in collaboration with Vanderbilt Behavioral Health. We have Dr. Aaron Brennan, who will be presenting on cognitive behavioral therapy and psychosis. And on the 22nd, the following Wednesday, we are doing a program specifically about LGBTQ youth and mental well, how to help them with mental wellness.
thank you, Don. And that is a big focus of us around here, is mental wellness, and mental well-being. And speaking of our biggest event of the year for mental well-being and a celebration of mental wellness, we want to let you know that we're really, really close to getting out the save the date for our 2023 NAMI Davidson is our NAMI Walks Greater Nashville event, which will be on May 20th, 2023 at a new location. We have been doing a walk for 10 years and we are moving. We've outgrown Shelby Park where we've been for years, and we are going to be at Bicentennial Mall Park in between the Farmers Market and the Sound Stadium. So we are very much looking forward to our new location. Last year we had 850 people. We're hoping to hit 1,000 this year, and we're hoping that you're going to be one of them. This serves as our biggest fundraiser of the year and our biggest awareness event of the year. And it is a love fest for the mental health community. It truly is. It is such a positive event, and in addition, and it's gonna be a little change this year. There'll be changes, and we'll be making those announcements along the way. But we'll still have our community walk and our pup parade. So if you got a dog, well-behaved, leashed puppy dog, bring him out. We know how good those guys are for mental health. So so at this time, I am going to again thank Natalie Metzger, and we look forward to all the good work she's going to be doing with us in her capstone project. I want to give a shout out to Ann O'Halloran and the folks over at Vanderbilt for the Rock Garden project. And thank every one of you for joining us tonight. If you had a question that you would like to ask that maybe you are not comfortable doing in front of a group, I'm gonna refer you to Dawn and outreach at namidavidson.org. Our phone number is 615-891-4724. You can call our informational weekday helpline. If you have a crisis, if you have an emergency, I always want you, if it's a life-threatening emergency, we always want you to call 911. If you have an urgent mental health care concern, you can call 988. We have some very supportive places. We've got Vanderbilt. We've got the walk-in clinic over crisis unit at the Mental Health Cooperative. Help is available. You don't have to do this alone. Whether you are someone with lived experience or a family member, you don't have to do this alone. And when we say we understand because everybody in this organization either lives with, is an and or a two-hatter, living with a mental health condition, and is a caregiver, or is one or the other. So so thank you for taking time to be with us tonight. We really appreciate it.